how we go.
Good morning, everyone. Good morning. Welcome to our press conference on Medicaid, on the impacts of block grants or caps to Medicaid. I want to welcome everyone here. I'm Patricia Yeager, the CEO of the organization, and I want to let everyone know there are handouts in the back, particularly for the press that might need more detail of statistics, numbers, that sort of thing. So we have handouts in the back, and everyone is welcome to take a copy. Our goal today is to inform our community, people with disabilities, their family members, and the community and at large in El Paso County and the Pike Peak area about what could happen if Medicaid caps or block grants are enacted. There's a vote coming up tomorrow in the House of Representatives that's going to radically transform Medicaid as we know it. And the part of Medicaid that we're talking about that impacts our community is called Long-Term Services and Supports, LTSS. You'll hear me say that. Long-Term Services and Supports help people to live in the community. Public policy in this country for the last 20 or 30 years has been moving people out of nursing homes into the community, developing community support so that your mother, your grandmother, your brother, your sister with a significant disability or functional limitation doesn't have to go to a nursing home, but can live in the community with support. Family members don't have to quit their jobs to take care of that loved one. They can still work and pay taxes and get support in keeping that person at home. This has been our policy, but we are about to reverse it. And we're reversing it at a time when Medicaid nursing homes in this county cost $6,900 a month per person. Now that's a lot of money for very expensive housing that nobody wants to live in. And so all this work has been done to have home health aides, to have food brought into the home, homes made accessible, medical services, and we're about to undo that. There are not enough Medicaid beds in the community, and at $6,900 a month, I don't think we can afford that. In Colorado alone, there are about 100,000 people using long-term services and supports, so that would be about $7 million a month to house and feed and keep those people alive. So, in the back, there's a sheet that talks about all the types of services that will be curtailed or reduced. That will be up on our website, so please do check the website and see what it does, how it will impact you personally. And it's time to go and talk to our legislative representatives, Representative Lamborn, Senator Bennett, Senator Cory Gardner. We need to let people know how this is going to impact you. It's right now it's a very abstract kind of a concept, and the people who vote in Washington need to know that this is going to affect you and how, and is that okay with you? Is that okay with them? The options here are pretty limited. You know, if you have a family member that you're caring for, you're going to have to quit your job and take care of them, or try to get them into a nursing home. And if the nursing home isn't available, which if these benefits are cut, nursing homes may not be available. Then what? What happens to people in their 80s, kids with significant disability? What will happen to these people? It creates a whole nother level of problems. So we are asking our legislators to maintain the current 50-50 split for payments between the state and the federal government for long-term services and supports. We are asking that we improve access to Medicaid to those long-term services and support so we can get more people out of the nursing home and end this bias to just put someone in a nursing home willy-nilly. Finally, we want to remove the sunset for the community first choice program. And this program is a program that pays the cost of getting a person out of a nursing home and living in the community. And today we have 3 people who are speaking, and one of them is a person who landed in a nursing home for several years and is now out living in the community and is working. So this community approach is so much better for people with disabilities and costs so much less and we're about to put that all down the drain. I want to introduce the three people who are going to be talking and have them spend just a minute or two telling their story of how they live and what these Medicaid cuts and changes will do. So I'm going to start with Marcia Unruh. Marcia is a staff person here, and she's a caregiver for her brother who had significant cognitive impairments. Marcia?
Thank you, Patricia. I'm speaking about being a caregiver for my brother Marty, who is 55 years old. And it is really difficult for me to talk about all of Marty's disabilities, as typically we focus on what a person can do and we don't focus on their actual disability. But I need to give you a really accurate picture of what Marty cannot do and what Marty is like. Marty has an intellectual disability. This means he cannot read. He cannot tell time. He doesn't know what a week, a month, a year is, the date. Very confused about that. He requires consistent and ongoing reminders to eat, to sleep, to dress, to shower. When he does get dressed by himself, it's this: do I have the shoes on the right foot? And are my pants on backwards? And sometimes he wears fleece in the middle of summer. He doesn't just quite understand appropriate dress. He is unable to make safe decisions and has inappropriate behaviors that put him and others at risk. He has no stranger danger. If you are in a uniform, he thinks you're a policeman and you're a friend, and he'll let you in, and he'll go and talk to you. If somebody shows up at my front door with a hard hat and a vest, he thinks you're a city worker and you're obviously there to help him out, so you can come in the house as well. He has trouble expressing himself and processing information, and according to the Division for Vocational Rehabilitation, he is unemployable. So Marty has cerebral palsy, which leaves his right side weak, and he has some balance issues, so he is prone to falls as well. He has multiple kinds of seizures, to include drop seizures with no warning whatsoever. He is colonized with MRSA from multiple surgeries that he has. So when he goes into a hospital, we gown up, nobody can come see him, he is in isolation. He has osteopenia, brittle bones, sleep apnea, and he's in year 4 of being cancer-free after having his gallbladder removed. Yay for that. Marty has fused vertebrae in his back, which cause him to be unable to straighten his back. And his foot is bent on its side, so he struggles with walking as well. He gags and he chokes when he eats, whether it's stuffing his mouth with food or drinking something can be really difficult for him. He does not sleep through the night at all. Most nights I don't get a lot of sleep myself. His day attendant takes him to doctor's appointments and ensures he is safe, healthy, and happy during the day and well fed. And then I am with him in the evenings and on weekends. So if his long-term care Medicaid services are taken away, he would lose his attendant support. That attendant would be unemployed. I would have to quit my job in order to stay home with him because I want him living in the community. I don't want him living in a nursing home. This allows me no respite because I would be taking care of Marty 24/7. Losing Medicaid means I cannot support him or myself, and our quality of life erodes. I'm a sibling, and I can't even imagine what happens to elderly parents who have a loved one with a developmental disability. Thank you.
That's a pretty significant impact on just one person, and there are so many more just like him in varying degrees of severity. So next I'm going to have Paul Spots speak. Paul is our our assistive technology specialist, and he works while he's on benefits, which is really the gold standard. It's what we hope for all people with disabilities, to be able to work, earn a living, and keep their Medicaid long-term services and support. So, Paul?
Good morning, everybody. My name's Paul Spots, and I'm a quadriplegic that needs assistance getting up in the morning to get dressed, getting in and out of the shower, and doing transfers, just to name a few things. to live as independently as I can in the home that I own. Medicaid is the only insurance plan that provides me with long-term personal care assistance in my home. I pay into Medicaid, I'm not on Social Security, and I work here at the Independence Center, but I need this Medicaid program to receive in-home personal care assistance. Without these services, I would lose my personal care attendant, which means I wouldn't have any assistance helping me get ready for work. I don't have family members available to fill out, I don't have family members available to fill in without causing financial burden to them. Not having this service alone means I could end up losing my job because I would have to pay out of pocket to have a personal care attendant for 6 hours a day I need every day. Then I would end up losing my home and then having to go into a nursing home. Taking away this service will not only affect me, but millions of people with disabilities as well.
People are success stories. They're people who have, live a quality life in spite of their disability, with their disability, and Paul makes a tremendous contribution here at the center. This next person, Charlene Youngblood, is one of our success stories for sure. She was living in a nursing home, and we were able to transition her out, which was kind of a scary proposition, and now she's working and paying taxes. So I want to ask Charlene to talk a little bit about how these cuts will affect her.
Make a U-turn without running everybody over.
I'm Charlene, and I do work here at the Independence Center. But 5 years ago, I was put in a nursing home, and I needed to be there at the time. I was unable to walk, sit, roll over, do anything. So I didn't need to be in the nursing home at that time. My husband came to visit me every day, and I had that hope of recovering and enough to get back and share and go home. After a short time there, I did start getting better. I was in a wheelchair and looking forward to that time where I would be going home, and my husband died unexpectedly, and I had no idea where I was going to go. At that time, I had no hope of getting out of the nursing home, and nobody chooses to live in a nursing home. The life there, I mean, it's not a life. You go through the motions every day of existing. You don't have much hope for the future, and eventually you stop caring. So when I was contacted by the Independence Center and found out about the Community Transition Program, it absolutely changed my life. I had that hope again. It took a while. It took about a year to get out of there, but when I woke up in the morning, it wasn't that depressed feeling of, where am I going? Nowhere. I had the feeling of, I'm going to get out of here and I'm going to be able to do things again. That was huge. Simple little things like we take for granted. Waking up in the morning, go to your kitchen, get a cup of coffee, make a breakfast. You don't get to do any of that in a nursing home. You take for granted getting up whenever you want, taking a shower. You don't get to do that in a nursing home. You maybe are scheduled twice a week if there's enough staff to do it. Otherwise you might wait 3 or 4 more days for your scheduled shower. So that's not living. So being independent now, living in my apartment, I don't take those things for granted anymore. Those things are really huge. And I think of the people now that are my consumers that have transitioned out of the nursing home that do need that care. If they lose that care, they can't take care of themselves to go back to the nursing home. That's just unbelievable that could happen to these people. Other things that it would impact, of course, the Medicaid, my chair. My power chair is my life. I'm not confined to my apartment. I can go anywhere I want in my power chair. And every day I wake up, I think of what new things can I do today? Where can I go? All these things that I didn't have in the nursing home. And to lose that, it would be devastating. Medical things, like I said, my power chair, I don't know who would pay for my power chair to fix it if I didn't have my Medicaid coverage. So it would definitely affect you in a big way, and a lot of the consumers that I work with too.
The program that helps people move out of nursing homes is scheduled to be sunset in the next year, and we are hoping that it will be renewed, but it's not included in the American healthcare plan. And the caps that are coming on to the Medicaid program, they're talking about per capita cap, which would be about $11,000, $12,000 per person annually. Now, that doesn't pay for much for people's home services. On an annual basis, $11,000. You can imagine that people's health are going to deteriorate, their families are going to break up, and we're going to see shortened lives actually as a result, as the ultimate result of losing these funds. I just can't stress enough how important it is for people who are hearing this and seeing what we're talking about. If you're impacted by, if you use Medicaid, you are going to be impacted. If you use long-term services and support, you are going to be significantly impacted. And it's time to call your congressman, call your senator, and talk about not capping or putting into block grants the Medicaid dollars that support people with disabilities, whether they be children with disabilities, adults with disabilities, or seniors with disabilities. These are people that have no choice in the matter. They are where they are, and we need to be helping them live in the community and live a great life, as Charlene has so eloquently pointed out. I'm going to see if there are questions. Are there questions from the press? Anyone in the audience? Seeing none, then I'm going to let the press know that the people who spoke are available for comments, and probably there may be other people available for comments as well. We have paper in the back that has facts and figures and all those kinds of things. So please do take it and help us spread the word. So thank you very much.